It's that time of year again. The flowers are beginning to bloom, the trees and grass are turning green, and we want to get outside to really enjoy this spring weather, right?
But
what's the problem? No
spring
problems.
allergies, yeah, they can leave many of us sneezing, sniffling, and just feeling downright miserable.
Most of the South is at moderate to high tree pollen levels right now, and those in the northern states are probably beginning to feel that tickle in their throat as well.
Well, let's get some relief. We got some help in studio here. Dr. Kasey Lanier is joining us. She's an allergist here in Atlanta with the Chacko Allergy Group. Thanks for joining us here. Let's talk about this. Are there particular regions of the country right now where we are really seeing worse than average allergy conditions?
Well, the whole East Coast is suffering, but the Midwest and Southwest are having a little bit of a harder time than normal this year. And then Florida's in kind of a unique situation as well. So only the Northwest kind of protected this year.
So when we're seeing those unseasonably warm temperatures early, like we have in many years past, what does that do for our allergies and some of the pollen that's coming out?
So it lengthens the time of the whole pollen season, so you're going to be using meds longer, but also makes the pollen seasons worse. So the trees themselves are more allergenic when it's warmer temperatures, so bad season and long seasons.
So, you know, I know people, and I am one that's never had allergies before. Moved to Atlanta, and now I have allergies. How does that happen? Like, aren't you supposed to be immune to it if you've never gotten it before?
Yes. Atlanta is the city of trees, so it is a pretty bad place for tree pollen sufferers in the spring. So, and it sometimes takes a couple of years to sensitize after you move. So that's kind of how that happens, is you develop the sensitivity over time.
Okay, we're deep in the pollen right now in the South in Atlanta, but for other parts of the country, Midwest, Northeast, Mid-Atlantic, maybe it's not quite that bad right now. So how early should you jump on remedies or perhaps allergy medicines before the pollen goes crazy?
So I would say mid-March to mid-April everywhere is going to be the worst time for the pollen. So if you can get on meds before that, kind of prophylactically, that is going to help you.
What about other areas? When are they anticipating? Because like Paul mentioned, we're kind of deep into the South and the pollen season right now. But what about, say, the upper Midwest or the Northeast? When can they expect to start feeling those allergies?
So even now, some of them are already kind of feeling that with some of the warmer weather. But then when it gets cool, you get better. So I would say for them, it would be a little bit later in March. But getting on meds soon would not be a harmful option.
And so you speak about meds. So you have nasal sprays, you have all types of different medications. Is there one that's better than the other, or you know, what do you suggest?
So nasal spray is really targeting where the congestion is, those blood vessels in your nose. Nobody loves using the nasal sprays, but they are pretty effective. And now some of them can just be used as needed. So like a nasal antihistamine, I really do suggest if you don't have bad symptoms. If you do, then I would definitely add on those oral meds and maybe allergy shots.
Okay.
So there are a lot of people out here who don't like to take medicines and pills, but is there a big, I guess, impact to your body if you take this allergy pill or shot, you know, for week after week after month after month? Is there kind of a negative or side effects of it?
Yeah, great question. So the second generation antihistamines that we have now, there's not any long-term adverse effect at all. You wouldn't want to take something like Benadryl, first generation antihistamine, all of the time. And then the nasal medicines, like I mentioned before, kind of get in and out, and so that is a good option. If not getting relief, immunotherapy, allergy shots is a good way to get off meds.
As an allergist, I mean, as meteorologists, we see that, you know, warmer weather is happening earlier and earlier every single year. What impacts has that had for you? Are you seeing allergies happening earlier and earlier every year?
Yeah, we definitely are, and this has been past 15, 20 years, but yeah, many more people on allergen immunotherapy. I think there's something upwards of 100 million people that have tree pollen allergies in the country, so a lot of people coming to see us.
Okay, a question for you. You'll have like 20 seconds left. The pets.
Yes.
So I feel like the pets track it in the house.
Yes,
Is there
yes,
something that we can do about that?
Yes. Pets track in the tree pollen, later the grass pollen and weed pollen, and also dust. So I would use a wet towel to kind of at least get that top coat off of the allergens when they come in. And also when you come in, hop in the shower when you're coming in, get your hat off, take your shoes off. Don't bring the outdoors inside. Get those windows down.
Nice.
So.
And real quick, what about like this saline kind of nasal wash? Does that stuff really work?
Yeah, so it's kind of like an Etch-a-Sketch, right? You're getting everything that's pollinating kind of out of the nose, and so it's a good way to sort of reset. I would say not more than once a day.
All right, Dr. Kasey Lanier, great information. Thank you so much for joining us this morning.